Let's now discuss a front collecting point or mu point called liver 13, completion gate. Liver 13 is located anterior and inferior to the free end of the 11th rib, approximately 1 tsuen superior to the umbilicus. How to find? First, we have the quick method. Ask the patient to press their flexed elbow 90 degrees against the lateral aspect of the thorax, and the tip of the olecranon will be pointing to the free end of the 11th rib. Liver 13 can then be located on its anterior and inferior border. Or place the hand on the upper abdomen and with gentle pressure, palpate along the lower border of the rib cage until you can feel the free end of the 11th rib just superior to the umbilicus. Locate liver 13 on its anterior and inferior border. Located on approximately the same level, 1 tsuen superior to the umbilicus are Ren 9 on the midline and stomach 24, which is 2 tsuen lateral to the midline. Gallbladder 25 is located more laterally and inferiorly at the free end of the 12th rib. Needling 0.5 to 1 tsuen vertically or better obliquely in the lateral direction. Caution, peritoneum, hypertrophied organs, right, the liver, the left, and spleen. Actions or indications of liver 13. Harmonizes the liver and the spleen, regulates liver qi, especially the middle and lower burner, strengthens the spleen, opens the channel. Special features: front mu point of the spleen, meeting point with the tonify and the gallbladder channel, Hui meeting point of the Zhang organs. Liver 13 is very much used whenever liver qi stagnates and invades the stomach and spleen, preventing spleen qi from ascending, resulting in loose stools, diarrhea, abdominal distension, and stomach qi from descending, resulting in retention of food, belching, and fullness in the epigastrium. The use of this point will promote the smooth flow of liver qi and eliminate stagnation, as well as strengthen the spleen. It is therefore the main point to use whenever liver and spleen are not harmonized. Typically, the pulse is wiry on the left and weak on the right. Needled with reinforcing method, this point can also be used to tonify stomach and spleen. If moxa is used in addition, it can tonify and warm the spleen in spleen-yang deficiency. Summary of functions: promotes the smooth flow of liver qi and harmonizes liver and spleen. Manifested as hypochondrial distension, pain in the ribs, abdominal distension and pain, diarrhea, undigested food in the stools, borborygmi, and constipation. Liver 13 tonifies stomach and spleen. If moxa is used in addition, it can tonify and warm the spleen yang. Liver 13, located midway between the middle and lower jaw, is both a point of the liver channel and the front mu point of the spleen. The term mu means to gather or to collect, and the front mu points are where the qi of the Zhangfu gathers and concentrates on the anterior surface of the body. Liver 13 is therefore an important point to harmonize relationship between the liver and spleen and between the middle and lower jaw, with emphasis on disorders of the abdomen and intestines. According to standards of patterns and treatments, the essence of the 5 Zhang is all transported from the spleen. As the origin of the postnatal qi, spleen and stomach are considered to play a central role among the Zhangfu, transforming and distributing the essence of food and drink throughout the body. For this reason, spleen may be said to dominate the Zhang and the stomach the Fu. The close relationship of liver 13 to the spleen, therefore, is further reflected in its status as the Hui meeting point of the Zhang. In the same way that Ren 12, the front mu point of the stomach, is also the Hui meeting point of the Fu. The liver tends to excess patterns and the spleen to deficiency. Liver-spleen disharmony may originate either from the liver, when qi stagnation aggressively invades, obstructs, and suppresses transformation and transportation function of the spleen, or from the spleen, when spleen qi deficiency is unable to resist encroachment of exuberant liver qi. This process is reflected in the saying, anger is hard and the Zhangfu are soft. What is hard easily injures what is soft. And by Zhang Qingyue's observation, if anger occurs during or after eating, it injures the stomach and spleen. The origin of liver-spleen disharmony, therefore, may be either an excess condition of the liver or a deficient condition of the spleen, or a combination of the two. One characteristic of this disharmony is the fluctuation in severity of symptoms with changes in the emotional state and tendency for either liver qi stagnation or spleen deficiency to predominate at different times. Liver 13, which is able both to regulate liver qi and to tonify spleen, is the main point on the abdomen to treat all gradations of liver-spleen disharmony, giving rise to symptoms such as propensity to anger, distension and pain of the abdomen, borborygmus, diarrhea, and loss of appetite. Diarrhea due to liver-spleen disharmony is distinguished by two main characteristics. The first is that the diarrhea is often preceded by distension and pain, both of which are relieved after passing stools. The second is that the diarrhea frequently alternates with constipation, for which this point is also indicated. This pattern is frequently encountered in irritable bowel syndrome and premenstrual bowel disorders. Liver 13 may also be used for spleen disharmony without liver complications, or liver disharmony without spleen complications. Throughout its action of fortifying the spleen, it is indicated for weariness of the limbs, emaciation, injury to the stomach and spleen from overindulgence in eating, and diarrhea containing undigested food. By resolving liver qi stagnation, it is able to treat esophageal constriction, fullness of the chest, focal distension, pain of the lateral costal region, and constipation. If liver qi stagnation leads to stasis of blood, there may be abdominal masses, and in terms of Western medicine, enlargement of the liver and or spleen. If liver qi stagnation transforms to fire, there may be agitation and heat with a dry mouth, mad walking, and propensity to anger. If the liver is deficient, there will be propensity to fear. If liver qi invades the stomach or lung and impairs their descending function, there will be vomiting, cough, or dyspnea. Through its dual action on the liver and spleen, liver 13 is also able to drain dampness or damp heat from the middle and lower jaw with such symptoms as jaundice and frequent urination with turbid white discharge. The liver channel is interiorly, exteriorly coupled with the gallbladder channel, which controls the sides of the body and facilitates turning and bending. Liver 13, a meeting point of the liver and gallbladder channels, is located close to the waist and lumbar region and is indicated for rigidity of the spine, lumbar pain, and inability to turn and bend the waist. The Great Compendium of Acupuncture and Moxibustion recommends liver 13 for cold and pain of the lumbar spine, whilst Sun Si Miao in the 1000 Ducat formulas is more specific and recommends it for cold and painful lumbar spine in men. Liver 13 is finally indicated for the pattern of running piglet qi arising from severe stagnation of qi. According to the essentials from the Golden Cabinet, running piglet disorder arises from the lower abdomen. It rushes up to the throat with such ferocity that the patient feels he is close to death. It attacks and then remits. It is brought about by fear and fright. Running piglet qi primarily arises when stagnant liver qi transforms to heat, or when kidney yang deficiency leads to accumulation of cold in the lower jaw. In both cases, qi is violently discharged and rushes upwards along the penetrating vessel. In clinical practice, running piglet qi may be encountered in a number of variants, all involving a rushing sensation, usually upwards along the trunk, back, or limbs. It is usually accompanied by feelings of intense anxiety. Thank you very much for your attention.